Hello everyone, I'm Dr. Avinash Verma. I'm Cardiac Electrophysiologist. Cardiac Electrophysiology is a branch of cardiology which deals with the arrhythmias and the electrical issues of the heart. Some people are born with certain issues with the heart which can cause their heart rate to go very fast. So just by sitting, their heart rate would go to 150, 180, 200, 220, 240, that fast without any reason. It may last for a few minutes to hours, sometimes days. Then they have to go to hospital. Sometimes it self-terminates. Sometimes they have to go to hospital and some injections are given, some medicines are given, then the heart rate becomes normal. So this problem usually starts with few episodes in a year and it keeps on increasing. Both the frequency and the duration keeps on increasing. So it's a very common problem. The common term used in medical language is called PSVT, paroxysmal supraventricular tachycardia. It's basically a kind of arrhythmia, dysregulation of heart's rhythm and rate, which can happen sometimes. Usually it is caused by the extra conduction pathways which are there in between the upper and the lower chambers of the heart, which are there by birth. These are not the connections which are made after birth. So you are born with it. They are not acquired later on in the life. Who has this and at what time it can present is very random. So anyone can have this. It's not genetic. So it doesn't transmit via parents. It's just one of those mutations that can happen, just like a mole or any other variation. It can happen. It can present at any point in the life. It can present in young age. It can present in old age. Most often than not, it's a bimodal presentation. More often than not, it presents in early childhood or young adults. And in that case, the presentation is palpitation, fast heart rate, and when you go to hospital, your ECG records a very fast heart rate for around 180 to 200 to 220 beats per minute. In that case, we take the patient for EP study. We put some electrodes in the heart, like the shown here. So this is a 2D EP study in which we use the fluoroscopy to place a lot of electrodes inside the heart, up to 10 to 20 electrodes inside the heart, and we take electrical impulses from various parts of the heart and we analyze it. By doing this, we can figure out where this extra connection is, where the extra pathways are. And once we figure out, we can take our ablation catheter there, which gives a radiofrequency ablation energy, which can damage these pathways permanently. So these connections are very small connections, few millimeters, 1 to 2 millimeters connection, and they are easily curable by burning them. Once you ablate them, they are gone forever. So there are very few ailments in the heart which are permanently curable. These are one of them. So even though it's very distressing when your heart rate goes very fast, but it's something which can be cured with 99% success rate. So radiofrequency ablation. So the entire procedure is called electrophysiology study, EPS, plus radiofrequency ablation. So electrophysiology study is study of the electrical system of the heart. It includes both the normal system and the arrhythmias. Once we study it, we can find out the characteristic of the arrhythmia, type of arrhythmia, and the location where it is, the substrate is there which is causing the problem. And once we find out, then we take the radiofrequency ablation catheters and we can ablate that area or burn that area and cure the patient of this disease permanently. So this entire procedure is EPS plus radiofrequency ablation. We can do that procedure in two-dimensional study like we did here. This is a basic study, or the study which was done in a resource limited setup, and also in olden times this was the study which was done. For simple arrhythmias this can suffice, but for complex arrhythmias, for ventricular tachycardia, atrial fibrillation, other complex type of arrhythmias, we might need a three-dimensional EP study and radiofrequency ablation, for which the entire 3D setup is needed. Which we do in Delhi, and we do largest number of complex EP cases. So if someone is having some rhythm issues of the heart, particularly fast rhythm or sometimes even slow rhythm, then they should consult a cardiac electrophysiologist. That is my suggestion to you all. If there is any problem, you can go to your cardiologist and they can further refer you to a cardiac electrophysiologist. So if you have any questions or doubts, you can send it forward to the concerned hospital and we can take care of that. Thank you.